This presentation is about FAO perspective on food systems, livelihood, and prevention of malnutrition. To find the right interventions for the right child and mother at the right time, we need to bridge the work of two communities, namely the agriculture and food system community and the nutrition and health community, ensuring that their agendas and efforts are complementary. Here we stress the importance of taking the context-specific drivers into account to ensure that the nutritional needs of the most vulnerable people in food insecure communities are timely addressed. It is about building complementarities between environmental, economic, and social outcomes and nutritional and health outcomes. Looking at food security, but also dietary intakes and anthropometric indicators. Considering the ecosystem where the communities live and operate. Targeting not only the household, but also the children and vulnerable people within. Working to increase the productivity and availability of nutritious foods, while also considering their accessibility and affordability. Taking a comprehensive view on seasonality, the raining and vegetation patterns, the changes in the water surface, the terms of trade, but also the seasonal trends of disease and peaks of acute malnutrition. The priority actions included in the GAP framework within the food and social protection systems are not new. What is new in the GAP framework is the approach when it comes to systems transformations. For example, when working with supply networks, we should look at how the priority actions will contribute to delivering safe and nutritious foods that are also accessible and affordable to vulnerable women and young children. When working with key public institutions, such as public schools and agencies, we should look at how the priority actions will unblock the supply and demand for locally produced, safe and nutritious foods that contribute to better diets, including access to specialized foods in specific contexts. When working with government and non-state actors, we should look at how data and analysis help to build consensus, taking into account livelihood dynamics and seasonality that shape the access and consumption of healthy diets. As mentioned, the priority actions included in the GAP are not new. A review of national policies, strategies, and plans reveals that most of the identified priority actions are already present in national documents, although with different degree of details. The same review highlighted a number of areas that could be further improved, such as the work with sectors beyond crop production and livestock, including fishery, aquaculture, forestry, highlighting the role of indigenous and underutilized food resources. The promotion of One Health approach to bring together multi-sectoral efforts around food safety and prevention of foodborne diseases, and also the opportunity to look into safe complementary foods for young children, just to mention a few of them. This example from Kenya illustrates what has been done differently in the design, finance, and implementation of an emergency and resilient building program because of the integration of livelihood dynamics and seasonality. This project was presented in more details on panel 3, so I'm not going to go into the detail. This example from Somalia illustrates the link between a livelihood approach to support local producers and the design and use of social protection scheme in ways that increase access to and consumption of nutritious foods in areas of high risk for child malnutrition. The message here is that there are already promising policies and operational examples from which we can learn if we want to replicate, adapt, and scale up feasible solutions in different contexts. Taking the drivers into account is not impossible. It can be done if the aim is to prevent malnutrition, and the time is now. Thank you very much.